FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz. Today is 11/11/19. I'm mentioning the date because it's a significant date from a numerological standpoint, if no other, and I think it's interesting. Anyways, what's really interesting are the pledges that these purported candidates for president, and I don't really think they are true candidates. I think, for instance, Joe Biden is what I would call a placeholder because they have nobody better. They got to have somebody warm the seat. So they got Joe Biden doing it because, well, I don't want to make fun of people's age or infirmities, but Joe has definitely seen better days. Joe has been around the block. And then we got Bernie, the robust, near octogenarian. And we got Lizzie Warren, and they're all, well, Liz Warren, Bernie, all Medicare for all. And they're all in for it. They're all in on it. And maybe you need to know what Medicare for all is and who better to educate you than Sally Pipes. Sally's been on a number of times. She's CEO of the Pacific Research Institute, which is a San Francisco-based think tank, and her latest book, The Cure for Obamacare, and a number of other books. Sally, it's great to have you back. So Medicare for all, it sounds like a blessing.
Well, definite, yes, and happy Remembrance Day today.
Yeah, of course.
Medicare for all. What Medicare for all really means is there would be no private insurance at all. All private insurance would be banned, including the 180 million Americans who have employer-based coverage, and 71% of those people say they rate their health care as good or excellent. But under a single payer plan that Senator Bernie Sanders and Senator Elizabeth Warren are promoting, all private coverage would be banned, and the government would be totally in charge of our health care. Candidates Warren and Sanders are the two that are really now pushing Medicare for all. The other candidates you mentioned, Joe Biden, Mr. Buttigieg, and some of the Castro, all these people, they're supporting stepping stone approaches to Medicare for all, i.e. building on Obamacare, and putting into Obamacare or into the market a public option, which would mean that public option being a government insurance plan where a government insurance plan would be competing against private insurers in the exchanges or in the market. Now, what would happen is that the government would price their plan, their public option plan, cheaper than the private sector can offer plans, because government doesn't matter whether they lose money. And so ultimately, the private insurers would be crowded out of the market, and slowly all America would again be in a single-payer Medicare for all program.
And when we say Medicare for all, what does that really mean? Because if you're not a person who's 65 or older or a disabled person, generally you don't really know what Medicare is. So what exactly is Medicare?
Well, Medicare is the program that came into being in 1965 along with Medicaid under President Lyndon Johnson's Great Society, where anyone over the age of 65, could sign up for Medicare. In the first year, it cost $3 billion, and there was no congressional budget office back then, but the powers that be predicted that Medicare for all in 1990 would cost $12 billion. In effect, it cost $110 billion. So when we hear the numbers that Senator Warren and Senator Sanders are throwing out at the cost of their Medicare for all programs, Bernie Sanders saying his plan would cost somewhere between $30 and $40 trillion over 10 years. And that number is actually reinforced by work done by the Urban Institute, a liberal think tank, the Mercatus Center, a more right-wing think tank, and the RAND Corporation, which is somewhere in between. They all predict that those would be the cost. And then Elizabeth Warren, of course, came out November 1st with her Medicare for all cost estimate, which she says it would be $20.5 trillion over 10 years in new federal spending. The whole program, she said, would cost $52 trillion over 10 years, whereas the plans, Mercatus, Urban, and Rand say their plan, the total cost of the plan would be $59 trillion over 10 years. Under these plans, the government would be the sole provider. Everyone would be in Medicare. There would be no Medicare as we know it today for people, as I say, over age 65. Medicaid would be rolled into the government plan as well. And all that would be left would be the government program, the Indian Services Healthcare Plan, and the Veterans Administration. So, we've seen a tremendous increase in the cost of the Medicare plan. It's about $600 billion a year. And a number of doctors, because they are reimbursed at rates tied to reimbursed at rates 40% below what they get paid for treating private patients, a number of doctors are not taking new Medicare patients. So that puts a lot of stress on people who are over 65 and don't have, a Medicare supplemental plan or a Medicare Advantage plan, or have employer coverage from before they retired. But this whole Medicare program is what, under Sanders' plan and under Warren's plan, all the ways that they say they would reduce costs, i.e., if you think it would be cheap at 30 to 40 trillion over 10 years, they would reduce costs by cutting payments to doctors and to hospitals. And they say so the doctors would be faced with the Medicare rates, which are 40% below what they get paid, as I just mentioned, for treating private patients. And so what would happen is that a lot of doctors, particularly those 50 and over, would most likely retire from being doctors, and we would ultimately have a doctor shortage. And I believe that the best and brightest kids, if they're going to be paid, at Medicare rates and the government's going to be in charge, the best and brightest young people would not go into medicine. So we've seen Pramila Jayapal, the House member from Washington State, who has a single payer bill even more comprehensive than Senator Sanders' bill. She said 1 million people would lose their jobs in the insurance industry. Warren has said 2 million people would lose their jobs, 1 million in the insurance industry, and the other half would be doctors and hospitals, doctors and hospitals and regular doctors losing their jobs. And she says, well, when asked, well, what will these people who lose their jobs in the insurance industry do? Well, she said, well, they can go and sell auto insurance or home insurance, if they're not transferable.
Yeah, that is such a naive, disingenuous approach to the whole thing. And look, I don't think the system that we have right now is so wonderful, but it does have benefits to it. But when you look at it, most of the problems that we have in the system now have been created by the very same government and people that are now being tasked to solve it. And look, let's just take a look at outrageously high prescription drug prices. All right. Yes, the pharmaceutical companies have to make a profit. But every time I look, these generic drugs, which cost them nothing to make and nothing to market, go up 10, 15%. There's something wrong with the system, and it's got to do with government price fixing, right?
FSN Radio. It's all about what's next.
Financial Survival Network is brought to you today by Orin Resources, a junior exploration company with the appetite of a major. It's hot on the trail of the next globally significant discovery, creating enormous potential upside for you, the shareholder. Orin is one of the most aggressive exploration companies pursuing high-grade, scalable gold and copper deposits, and has a premier 7-project portfolio, including its 2 flagships, Committee Bay in the Arctic and Sombrero in Peru. Orin's unparalleled technical team and highly experienced management has a history of success in advancing and monetizing exploration assets. No wonder Orin's been called one of the best in the junior exploration sector. Orin trades on the TSX and the NYSE under AUG. To learn more, go to orinresources.com. That's AURYN resources.com.
The Financial Survival Network. It's all about what's next.
Well, absolutely. And as we've seen with the debates over H.R. 3 and Nancy Pelosi's, drug plan, which I don't think it is going to go anywhere in this session in this year. And I don't think that the Grassley, Senator Chuck Grassley, and I think it's Ron Wyden, the Democrat side, their drug pricing bill will go anywhere this year either. But it's interesting. I mean, there's been a lot of plans out there pushing an international price index where drug companies would have to tie the prices of their, drugs to a basket of drug prices in 13 other countries. Those countries, all of them have price controls, and so that they get their drugs cheaper because of price controls. But we in America are, paying the full freight for the research and development innovation of these new drugs. I think, and also that in a country like Canada that has price controls, a number of the drugs that are the new biologics, biosimilars, cancer drugs here that are available, that have been developed in the U.S., they aren't even available on the formularies in a country like Canada because the Patented Medicine Prices Review Board says even at the price control price they're being offered, it's still too high. So this is a complete, a disaster. We need to allow the market to work. Other countries, such as the UK, France, Canada, that have price controls, they should actually get rid of their price controls so that their people pay the real cost of these drugs, and that we in America don't have to pay the full freight for it. But we want to keep the market open so that the United States continues to be the innovator of these drugs that allow us to live longer and healthier lives.
Oh, for sure. But we've also got this system where it's legal graft, where third parties can buy and sell stuff to hospitals. And then we've got Caremark, who basically decides how much pharmacies, pharmacy chains, et cetera, are going to be reimbursed by insurance companies and by the federal government for the drugs that they approve. And they can even stop drugs from appearing in pharmacies because they just get rid of the reimbursement for it. So we kind of need to get rid of these middlemen. They're multi-billion-dollar companies now, corrupting everything.
Absolutely. Yeah, the pharmaceutical benefit managers, which these middlemen, which, at PRI, we've written a lot on PBMs and the impact that on the prices they negotiate. The cheaper prices of these drugs are not passed on fully to the patients who are getting their drugs at the drugstore. The PBMs are making all the money, and we need to change that. We need to change the 340B program, where that are for hospitals that are treating lower income patients. Now, so many hospitals are getting the cheaper drugs and treatments under 340B. And that was originally designed to help, hospitals in lower income areas treating lower income patients. But a lot of things are, as you say, out of control, and the government has allowed so many of these programs to come into being, and they're not helping the people that supposedly they're designed to help. And if we get a Medicare for All system, if Sanders became a candidate or Elizabeth Warren for president and ran against President Trump, if either of them were the candidate and defeated President Trump, they have made it their business to introduce a single-payer healthcare system. And we in America will face the same issues that Canadians have, where there'll be long waiting lists for care. In Canada today, under Canada's Medicare program, where anything considered medically necessary cannot be provided by the private sector. The average wait today in Canada from seeing a primary care doctor getting treatment by a specialist is just under 5 months. Back in 1993, that wait was only just over 8 weeks. And so there would be long waits for care. Care would be rationed. Our elderly people would not have access to care because the government would be so busy trying to get the cost of health care under the global budget they set, which instead of being what it is today, 18%, they would have to cut it back to about 11%. So that there would be so much waiting list, long waiting times, ration care, doctor shortages. And of course, these programs are not free. Senator Sanders says, well, our health care would be free. There'd be no co-pays, no deductibles, no premiums, and no referrals to specialists. Well, that just is not going to work because these programs are not free. And in Canada today, the average Canadian family, no premiums, no deductibles, etc., but long waits for care. The average Canadian family pays in hidden taxes $13,311 a year for a system that is not giving them access to the latest treatments or access to care. 323,000 Canadians cross the border every year and seek treatment in the U.S. for MRIs, CT scans, hip replacements, heart valve replacements, all of these things that, that they feel that the waiting time, is too long. Look at, Mick Jagger, the Rolling Stones frontman, when he was diagnosed with needing a heart valve replacement, he didn't go back to the UK and have it done under the National Health Service. He had it done in the US at the New York Presbyterian Hospital. And as his younger brother said, thank goodness Mick don't got to go, come back and have this done under the National Health Service. We cannot allow this country to go this way.
Yeah, it's so obvious that that's where it's going to head if this plan is adopted. But we also really need to greatly revise and totally reinvent Medicaid and Medicare, because they really reinforce the worst inefficiencies in the system, don't they?
Oh, absolutely. Yeah. I mean, government is never efficient. I mean, think about going to the DMV or the post office. But do you want those same people, providing you with your health coverage? I don't think so.
Mm-hmm. Yeah, I couldn't agree with you more. And so what do we do with Medicare? Though there are, tens of millions of people dependent upon the program. It has driven up the cost of health care, just like Medicaid has. And something needs to be done about it, but we can't just have a wholesale withdrawal of the government from the sector, or we'll see massive bankruptcies and we'll see people dying on the street.
Right. Well, as I say, when Medicare came into being under President Johnson, along with Medicaid in 1965, the average life expectancy at that time was age 65. Today, the average American lives to age 79. We need to really, under Medicare, change the age of eligibility. Yes, Medicare should be there for those people who truly need it. A lot of people, about 35% of people who are Medicare eligible are still getting their coverage through their employer. 29% of Medicare recipients have Medicare Advantage or Medicare Supplemental, because the Medicare plan doesn't, cover. A lot of people can't get doctors or they can't get coverage under the straight Medicare program. So, it's really interesting. We also need to means test Medicare. I mean, why should people like a Warren Buffett or Mr. Michael Bloomberg, who is 77 today, he shouldn't even be eligible for Medicare because he can afford to buy his own Medicare, his own private health insurance.
Couldn't agree with you more. So but that's only going to get us 35% of the way there. And, the other argument is, but we paid for this all this time. We spent our whole lives paying for this, and now you're taking it away from us. Aren't you evil?
Well, I mean, this is the funny thing, that we pay tremendous taxes for Medicare and Social Security. And then for those people who truly need Medicare, who don't, have these other options that people that are lower income, I mean, Medicare should be there for those people, the people who truly need it. But, we need to, as I say, open up the system, allow, people on Medicare today cannot, add funds to their health savings account, which puts doctors and hospitals in charge of their care. So we need to have, all of these things need to go so that Medicare can be there for those people who truly need it. But right now, it's a very expensive program, and it's not working for the people who are, on Medicare.
Yeah, especially with doctors dropping out of the system. Certain doctors, though, can't. Like if you're an ophthalmologist, you're going to earn the bulk of your income doing cataracts. I mean, that's just the way it is. And that's elderly people. And that is Medicare. There's no other way. And they've seen their reimbursements cut like 80% over the past 10 or 15 years. Because the government just looks at a category and say, all right, if we cut this 80%, we'll save X billion. They're not really concerned about the outcome and that it's that people are getting the type of care they should be.
Right. Well, my cousin is an ophthalmologist in Vancouver, Canada. In mid-November, his global budget for him doing cataract surgeries runs out. And so he can't do any more cataract operations until the start of the new year and a new global budget. And also the government, has been cutting back on the payments that he gets, and they want to, reduce the cost of cataract surgery to $49. $49. Meanwhile, he has to see a patient, decide if they need cataract surgery, do the surgery, have the post-treatment. This would not cover, $49 would not cover the cost of this. I went for my annual checkup at my OBGYN, and he's probably 60. And he said, I lose money on the Medi-Cal, or which is in California, Medicaid patient. I barely break even on the Medicare patients I treat. So in order for me to live and make money, I make my money on private patients. If we get single payer, I'm going to retire from practicing medicine, along with many of the specialists that I work with on, whether it's breast cancer, on radiation oncology. We're all going to quit medicine because the payment at 40% below, we can't make it.
Yeah. Oh, for sure. And then you wind up like I have some doctors, they're like my age, early 60s, and I'm looking at them, I'm thinking, why are they still practicing? It's not for the money, because they're making less money than they made 20 years ago. Maybe they've had, I don't know their personal situation, but I do know that every day they walk into that office, you're thinking about, is it worth it? Should I retire? And right, it's really,
yes, exactly.
It's a little scary when you think about it. Well, the solutions are out there. We just have to go and see if we have the political will to undertake them, if our leaders will do it. But I'll tell you one thing, Sally, all of these programs coming from the left have completely divorced from reality, because they're not acknowledging how the problems emerged. And, it's just like the doctor who sees you and you've got, you've got metastatic cancer, and he says, take 2 aspirins and call me in the morning. That's all this is going to do. It's only going to make it worse, lead to the eventual death of the patient, death of the system. And purportedly, that's what we should be looking to stop. Sally, if we want to find out more about you and check out your writing, where's the best place to go?
On our website, www.pacificresearch.org, and my latest book from Encounter, The False Promise of Single-Payer Healthcare. It's an easy read, and people need to read it to understand what Sanders and Warren's plans would do for our healthcare.
Amen to that. I've read the book myself. I can vouch for everything you're saying. There are no panaceas. There's no quick fix, but sound economic principles can bring us a long way towards a solvent medical system. Questions, comments for Sally or myself? We really do appreciate your emails. We want to know what you think about the Medicare for All conundrum. Just email us, kl@kerrylutz.com, Twitter feed @KerryLutz. Facebook page is Financial Survival Network. Sally, always a pleasure. Thanks so much for coming on.
Thank you so much, Kerry. Happy Remembrance Day, as I say. Take care. Bye.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.